Welcome back. We turn now to the ongoing measles outbreak in South Carolina. Today, the state health department announcing 124 new cases since Tuesday, bringing the total number of cases from the state's outbreak to 558, with most of those cases among children and the overwhelming majority among the unvaccinated. The outbreak is centered around Spartanburg County, in an area of the state where vaccination rates have been steadily declining. The state has activated mobile health units in the area, offering the measles, mumps, rubella vaccines to unvaccinated locals at no cost. Joining me now is Dr. Adam Ratner, a pediatric infectious disease specialist in New York City. Thank you so much. He's also author of the book Booster Shots: The Urgent Lessons of Measles and Uncertain Future of Children's Health. We really appreciate your being here. So let's start in South Carolina, the middle of an extraordinary measles outbreak. We've seen other states, of course, report their first cases of the year. We saw a major outbreak in Texas last year. Why are we seeing this influx?
Yeah, the short answer is that vaccination levels are dropping, and especially that we have small areas, concentrations of unvaccinated kids, where even if you have a high vaccination rate across a state, as we did in Texas, you might have school districts with much lower rates, and those are the places where outbreaks really take hold.
Well, and we just, for background to that, I mean, the CDC recently came out with updated childhood vaccine recommendations. The measles, mumps, and rubella vaccine is still on the list, yet MMR vaccination rates for children have been declining in recent years. Does that concern you, and if so, why?
Yeah, absolutely. I mean, I think we're in a situation where we have increasing numbers of measles cases. What we should be getting is just unambiguous messages from HHS, from CDC, saying that people should be getting their children vaccinated, that the measles vaccine is the way that you prevent measles, it's the way you prevent outbreaks, it's the way you keep people safe. And we are not getting those messages, even though the measles, mumps, rubella shot is still on the good list from the CDC. The fact that we're taking apart the vaccination schedule and confusing parents and making things really difficult for pediatricians and for parents to know who to trust, it does not help matters. Well,
and in 2025, according to the CDC, most measles cases since the disease was, or I should say, 2025 had the most measles cases since the disease had been considered eliminated. Did the United States effectively lose that elimination status?
So we are probably going to. That hasn't happened officially yet. The technical definition for elimination is more than 12 months of ongoing spread of measles. We are just about there. There are certification type things that have to happen for it to be officially lost. But I think we saw Canada lose their elimination status just in the last month or so, and we are likely to do so as well.
And so, big picture, I mean, what does this mean for the country's ability to actually contain these cases?
Yeah, I think it's a problem, and it's going to be a growing problem until we turn the tide, until we go back to the things that we know work to control measles. And those things are getting vaccination levels higher. School requirements for vaccines are really important. Measles is our most contagious disease. And so you need about 95% of the population to be vaccinated in order to stop outbreaks from happening. We were over that before the COVID pandemic. We have slipped under that as a nation. Some states have much lower levels, and some counties, or even at the school district level, some school districts have very low levels of vaccination. We need to turn that tide.
All right, Dr. Adam Ratner, thank you so much for the great information. We really appreciate it.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app, or watch live on our YouTube channel.